Okay, I think we are good for now. Okay,
Perfect.
I will get started. So just to add some context to this discussion for the audience and listeners later on. So this discussion is primarily aimed at people who are looking to either transition to a career in health informatics or even looking to start a career in health informatics. So well, I have recently started a platform called Health X Academy, and there is a pool of audience who is interested to know more about this space as a career option going forward. And in today's discussion, I'm joined by Dr. Kareem. And Dr. Kareem is a thought leader in the space, and also he leads the University of Toronto's IHPME Masters of Health Informatics programs as well. So, Dr. Kareem, welcome.
Thank you so much, Neil. It's a pleasure to be here.
All right, so we will jump right in. So I'm going to start with some news headlines that we just saw a few weeks back. Is Forbes listed Masters of Health Informatics as one of the most high-paying degrees in 2025. So that raised a lot of eyebrows, that raised a lot of discussion. So what's your thought on this? Why is it in the top five right now?
Yes, I think there's very good reason why it's at the top. You know, healthcare is becoming much more important around the world as our population ages, and um, populations are living longer, and they're living longer precisely because of all the medications and technologies that we now have available. We have fantastic diagnostic technologies. We have amazing treatments that enable people to live longer. And so, but those technologies are generating huge amounts of data. And who's going to analyze that data, make sense of it, uh, provide it in a way, manipulate it in a way that allows people to actually use it in a valuable way? That requires expertise. And that expertise is what is called health informatics. And that is why it is surging, because the Western world populations are aging and they are generating petabytes of data that need somebody to come and fix it for them.
All right. So we're sitting on heaps of data. Somebody needs to make the meaning out of it. So this is what people
That's
are
it.
being paid for right now.
That is very valuable because those people that are aging are called baby boomers, and they're the
Mm.
richest uh, demographic in the world today. So, of course, they're going to be paying top dollar, and their health is the most important thing to them. And so they're going to be paying top dollar for their health and their health information.
All right. Okay. So that brings on to my next question is, let's say in 2025, someone is looking to transition to this career in health informatics. What do you see are the key top three or five career pathways that people can think of?
Well, actually, there's a tremendous number of pathways. Okay, it's not just three or four or five. It's just huge, all the way from privacy and data governance to software development to information management to implementing, supporting doctors and nurses and using technology. There's many roles in health in digital health today or health informatics today. So um, I don't want to uh, limit the scope of it, but I'll describe a few. Okay. You might, for example, be implementing something. So there might be some technology, it needs to be implemented. You might uh, start out as a project coordinator, become a project analyst, become a project manager, and and so forth. You might start out as somebody who's analyzing data. So you might be a data analyst, and then you might be a data manager, a data scientist. These are all roles that you might end up taking on. There's uh, data governance. So an organization needs to make sure that the information that it's using is safe, being used safely, and achieving its strategic goals. That requires somebody who understands information. So that might be a decision support analyst. They might they might go on to become a decision support manager, a decision support director, and um, and so there are many roles. You might work for an industry um, as a software developer or a product manager or an implementation specialist because people need to be supporting implementation, or you might be a trainer because people need to be trained. There's a lot of roles in this space. But I just described a few verticals and a few settings in which you could work. So you could end up working for government, developing digital health policy. You could work for a medical association or a hospital association. Um, I've seen people who specialize in just in communications because this area is so complicated that we need specialized communicators who can communicate in this space. So lots of opportunities for a variety of different people with different skills and different capabilities.
Right. So is it fair to say that whether you have a clinical or a non-clinical background, you will have ample opportunities of growth and career building opportunities in this space?
Yes, definitely, because we need both clinicians who understand it, but clinicians are not going to, shouldn't be running a hospital or shouldn't be doing communications, or many jobs are not suitable for clinicians. And so what you want is non-clinicians as well to be doing those kinds of jobs.
All right. Okay. So now we know that there are multiple career opportunities, jobs, and all. Next is skills. What
Mm.
kind of skills would people need in the age of AI, like kind of soft skills, technical skills, other skills to thrive in this industry, let's say for the next foreseeable future?
Yes, I can tell you that, you know, my opinion about this has changed a lot over the last decade. There was a time when I thought hard skills was what you needed. And by hard skills, I mean, that you could program or you could uh, um, write, that you could analyze data or you could use an Excel spreadsheet or all these kinds of things. And the more I'm realizing now that those kinds of skills, hard skills, become obsolete very quickly, or you need so many of them that you can never have them all at one time. So the first skill I will tell you is that how to learn to develop a skill. Okay, you need to be able to climb up a skill learning curve in a very short period of time without taking a course and without having to have a degree, but just learn it on your own. Because you still need skills, it's just that skills are constantly changing. So you need to be able to learn new skills. Uh, in any workplace, you need the ability to communicate, group work skills, editorial skills, communication skills, how to work with the group and take their product and take it to that next level of communication. You need critical thinking skills. You need to be able to understand what's going to work and what's not going to work. Because vendors are going to come to you and say, hey, I've got something here. It's the best thing since sliced bread, or it's the best technology now available. You have no way to verify the claims if you just look at what they're telling you. You have to be able to verify claims. We live in a world where there's a lot of misinformation. How do you know that what you're reading is true? You may end up implementing something that does not have sufficient evidence, or you might be doing something that um, behaving in a way that does not have sufficient evidence. And now you wasted your time, you wasted your organization's money, and you lost credibility. So critical thinking is a very important part of the skill set that you need to have as well.
Yeah, and I think really in the age of AI, thinking is what makes you human. So you should have your own perspective. That's what I've learned the hard way. And yeah, talking of AI, know AI is making the headlines each and every day. So in this context, do you think any specific skill set that health informaticians should pick up in the next few years?
Yes, of course, we should always be learning about data because informatics is about information after all. And
Mhm.
so data are the building blocks of information, but it's not information itself. So we need to understand how to manage information, but we also need to understand how to manage knowledge. And as informaticians, we need to understand the difference between information and knowledge. And it's not the same as in other industries, by the way. So people will tell you, well, there's information, and then you refine information, and that takes you to knowledge. That's not true in healthcare. Knowledge is something separate in healthcare. So knowledge is what comes from our experimentation. It comes from our clinical studies and our research that we do that says, oh, yes, this drug does this thing. This surgery does this thing. This treatment solves this problem. So that's our knowledge. Information is the condensation of data that allows us to say, yes, this is the person to whom this knowledge applies. This person's blood pressure is high, but they're diabetic. So I need to give them this medication. That's what knowledge and information does. So we need to understand the difference between information and knowledge. And then when we apply artificial intelligence or data analytics or whatever, we can apply it in a way that makes sense to the case in front of us. And that I think is um, an understanding that people need to have. It doesn't have to be complicated, but they do need to know how to apply these new technologies to achieve a
Mhm.
particular end. As I explained to students, I may have explained it to you as well, is that app is not going to lower your blood pressure. It's a medication that's going to lower your blood pressure. But the app will help you remind you to take your medication. It can
Mhm.
also monitor thousands of people to say, hey, there's 5 people over there that are not taking their medication. What's going on? So it gives us information about our treatments. It is not a treatment in itself. And I think we need to also understand that information technology is not magical. It plays a specific role. Information is very, very important to achieve our goals. I mean, if you can't see your goal, or you can't measure your goal, or you can't measure how accurately you achieved, came close to your goal, you're not able to achieve your goal. So measurements are very important. And that's informatics is really about the manipulation of measurements.
Yeah, yeah. And I really recall the classes that we had about knowledge management as part of the program. That's even more important these days because we are drowning in
Yes,
knowledge and information. So
correct.
that is very well put. So yeah, which is
And
and really
I think that's a really good point that you bring up, Neil, which is that we are drowning in information. So I think that's where I see the role of AI. AI
mhm,
will help us corral or to manage that knowledge in a way that simplifies things because there's too much for us to learn. Even I don't know, they've stopped counting how fast knowledge is doubling, but you know, um, back 3, 4 years ago, the doubling rate was like 11 or 12 weeks. I'm like, yeah, it's down to a few hours now. And so nobody's counting anymore because the rate of knowledge and information is just growing exponentially.
yeah, yeah, for sure. Kind of you get to sleep and wake up next day with new pieces of information. So that's the pace that it's going right now.
Yes,
So yeah, so I think couple of questions remaining is University of Toronto. I know I have lived the experience of MHI, but I get many queries from people around the world about what is so special about the Masters of Health Informatics program at University of Toronto. So there's no better person than you to share this with us.
sure. Absolutely. So I think when we look at health informatics, Health informatics is an ecosystem. It's not a particular skill. As I explained to you, there's so many roles and so many, and we at the University of Toronto cannot do everything. We can't teach for everything that's in the system. So we play a particular role, and other universities play different roles. So, for example, I usually like to give the example of McMaster because McMaster is a very clear example of uh, a program, a health informatics program that is at the intersection of computer science, business, and medicine. So, if you want to learn how to build an app and commercialize it, McMaster is your best bet. Okay? Medicine, computer science, and business. University of Toronto does not have any relationship with computer science, business, or medicine. We're in the Department of Public Health. We are in the same department as health administration with quality improvement and um, leadership and innovation. Okay, so we're not going to become an app building uh, skill set producing entity. What we can do is we can teach about leadership. We can teach about management. We can teach about policy. And when we look at the healthcare system, healthcare is driven by policy, by leadership. And so digital health also requires policy and leadership capabilities. So we do teach, the basics of health informatics. You learn how to analyze data. You learn how to analyze workflows. You learn to analyze things, but you apply them in a very different way. So we apply our skills in the hospital, in government, in healthcare associations at a policy and leadership level. So, um, so I think that's where the University of Toronto is playing. And if you go to Waterloo, you'll see that their program is very much based in computer science and technology and artificial intelligence, more on the visualization side. Our artificial intelligence is more on the organizational side, as opposed to the clinical side.
All right. Yeah, this is really valuable for people to understand the unique position because kind of we don't get to see it on the data on the blogs and all. So this is really great.
No.
So while you talk about the leadership aspect, and I know you've been talking about the leadership course or a program that we are planning to launch, is it something which you can share with the audience at this point?
Yes, of course. Yes. This is the advanced leadership course that we're talking about.
Yes.
Yes. Yeah, so it's something that I've been working on for the last several years, Neil, is that look, you know, um, when I first started in this program as the program director, I said, we are the leaders. Digital health, health informatics, we are going to go and change the world. But no, we're not going to change the world by ourselves. Okay? We need to work with others. We are not finance people, but finance is also critical to change. We are not going to be CEOs or organizational people, but those people are also required for change. So when I reflected upon my, desire for system transformation, because we know that other industries have been transformed through digitalization, healthcare is also going to be transformed by digitalization. So we're going to have to play a role. And when I looked at that, I said, we as health informaticians need to be able to speak the strategic lingo. We need to be able to speak the finance lingo so that we are not seen as technicians, but we are seen as co-leaders. And we also need to learn how to work with the finance people and the administrators because that's the nature of the context in which we work. So I said to myself, how do I give that experience to our students? So I spoke to one of our professors who's uh, a leader in leadership. And I said to her, I said, Wendy, we need a course that gives our students an opportunity to interact with MBAs, with masters, people in masters of health administration, with pharmacists, with physicians, with the whole leadership team, so that they can develop their leadership skills, that they can have their leadership voice, that they can develop their leadership voice. And so we've constructed a course that enables exactly that. We went into the community and we asked people who are doing transformative projects and asked them to say, look, can we get one of our student teams so that we have an MBA, an MHI, a health administrative student, and one other student, maybe a PharmD or a MD or something like that. And we'll put a team together for you, or even a nurse, and we'll put a team together for you that can then work on solving some specific problems. So that's basically the advanced course. It is hands-on, it is relevant, it is real world, it is transformative, and we're only choosing business transformation projects basically.
All right, all right. Yeah, it means I have seen with my lived work experiences, this is really the gap, and people are looking for good quality kind of coaching, I should say, on this aspect. So this, I think this is a good way to fill the gap as well. So thank you for sharing that, Karim. So I think, yeah, I'm not going to make this too long. This is in sync with people's attention spans these days. So any last words of wisdom that you would like to share with the audience before we wrap this up?
Well, I just want to say that, health informatics is a fantastic career. This space is growing rapidly because it's just the nature of the world that we live in today. And we will have older people for quite some time to come. And so we need informaticians. Um, the the profession is very fulfilling because uh, although you're not seeing patients, you can see the impact on patients. And healthcare becomes more effective and more efficient when health informaticians do a good job. And so you will see the satisfaction in doing that. So I think it's a great career from that perspective. It's meaningful, it's growing, and there are fantastic opportunities in such a broad range of activities that everybody can find something that's meaningful and that they can contribute to.
All right, all right. Thank you, Karim. This was really inspiring, and now I think people should know why Forbes did list Masters of Health Informatics as one of the top five. So this is a
Indeed,
good answer to
indeed.
that. All right.
Yes.
Thank you very much. And I think I'm just going to wrap it up here. Okay, so I'll just keep the recording on, Karim, just for because I'll
Sure.
cut it off
Yeah.
there.
Yeah.
Yeah,
Yeah. Of course.
yeah. Okay, okay. This is
Yeah.
great. Thank you.
Yeah. Is it okay?
So, okay, yeah, yeah, this is good. Kind of, I'm just going to do clips and maybe per
Sure. Yeah.
question clips and
Yeah.
then
Yeah. Yeah.
post it
That's
like
good.
this and maybe tag
That's
you
fine.
over LinkedIn if that's okay.
Yeah.
Yeah,
Yeah. Of course. That'll be fine.
yeah. Okay, great, awesome. So I think you said you wanted to chat with me on a different topic, but not right now.
Yes. So I don't know whether you've been paying attention to the town halls, right? So
Mm-hmm.
uh, I'm starting to think about having 5 verticals of concentrations. So looking at AI and ML, leadership and policy, public health, governance, and interoperability, and one more that I can't remember off the top of my head. But basically, we'll have 5 verticals
All
for
right.
health informatics. Okay. And so I'm going to be decommissioning the last set of SIGs. We had the
Mm-hmm.
curriculum SIG, the student and alumni SIG, and thought leadership SIG, marketing SIG, and so forth. I'm going to start decommissioning those and moving to this new strategic implementation groups.
Okay, all right. Sounds
So
good.
I want you to think about where you might play and how you might get involved.
Is there a plan to introduce some courses on digital health product management? I'm really finding
Yes,
hard to recruit people in this space. I'm looking for
yes.
people. My team,
Yes,
yeah. So
yes,
PHSA, as you may know, right, we are transitioning to a product management model. So,
yes,
and we are finding it hard to find people who are trained in this aspect.
yes.
So,
I think that's definitely an area that we want to get ourselves into, because I'm seeing that as a big area. I agree with you.
mhm.
Um, Product management is a big, uh, and we haven't traditionally taught it, but um, I have to think about which of those verticals it would be in. Probably in the uh, either there was a consulting one, or in the AI and ML precision medicine one.
Mhm. Yeah,
Yeah,
this might suit in either of those.
yeah.
Yeah, yeah. Okay, all right. Sounds good, Gariman. Thank you so much for your time. It was nice chatting with you, not for the
Likewise.
podcast, but just like that, because we don't get to
Yes.
chat.
No, we
So,
don't. We don't. I know.
yeah, yeah,
I
yeah.
know. So, yeah. Are you going to come to the Flip conference?
I'm still planning. I'm still planning, kind of. I'm just
Okay.
because there's a go live that weekend. So if I get
So
to,
join virtually.
is there an option to join virtually as
There
well?
is a
Okay,
virtual
I will check
option.
out
Yes.
that.
This.
I will check
Yes.
out.
Just join virtually.
All right.
You know, we're going to have it every year. So next year will be another opportunity to come.
Okay, so but for this year, virtually for sure. All right.
Yes.
Okay.
Okay.
Thank you. Take care.
Wonderful.
Bye.
Thanks for taking the time. Bye.
Bye.